As for my own background and personal mission around this, stems from two things. One was less of a personal experience with ketamine and more the work I did prior to starting Enthea. So prior to starting Enthea, I worked on poverty reduction and lived in the world's poorest countries for just over a decade and built programs at the national level to help reduce poverty. But as part of that, I was just faced with the global mental health crisis, and I couldn't even do my work successfully because everywhere I turned, people were suffering from intergenerational trauma, intergenerational poverty, which leads to trauma, and all of these things that affect communities and doesn't allow them to heal. And so really, I became really impacted seeing this firsthand and then seeing that there weren't really solutions that we could offer that are effective. So I started looking for solutions and started seeing that, oh, well, antidepressants are only really effective for 15 to 20% of people that take them, but 57% have moderate to severe side effects. And then I started seeing up to 60% of people with a mental health issue are treatment resistant. Like, imagine how lonely that must feel to be suffering and feeling hopeless, because even if you do manage to get treatment, it doesn't work on you. And so I was very committed to finding something that worked. And that's when I stumbled upon some innovative treatments, like ketamine therapy and psychedelic therapy, and even things like transcranial magnetic stimulation, stellate ganglion block. Like, there are treatments that are out there that actually get to the root cause that people don't talk about or don't know about or are stigmatized.
I probably went in with zero expectations, which was probably a good place to start, but like the experience alone was just it's almost like undescribable, even though it seems like I was able to kind of describe it for people, which was good. But yeah, it was pretty awesome too that it was just so organic and just fully unfolded how it was supposed to for myself, which was beautiful.
Yeah, and I love like what you said in the podcast too about how you've continued it, because I think so much of Western medicine the last at least 70 years has very much been that potentiated illness model, or the pharmaceutical
Hmm.
industry and insurance industry. And honestly, most providers and agencies, are incentivized to keep people ill, keep people on daily medications and keep them coming back forever.
Yeah.
But like I haven't seen you in a long time.
Yeah,
And that's
exactly.
great. And
And
you're
it was,
doing it really well.
I really felt like I lived with this title, like, me having depression, me having anxiety, all these things was like who I was. And it's so refreshing to know that there's these alternative, medicines now that like you walk in and walk out and you're like, that is not who I am. This is just something that I'm dealing with in this moment. And so that was like a huge thing I learned through ketamine was like, no, this is just a symptom I'm having. This isn't who I am. And getting into that, like you're saying, getting out of the Western medicine world, it was like, okay, cool. Like, I don't have to just be this person that I'm being diagnosed as. And that was like really, really nice for me personally. Yeah.
Dr. Casey brought up a really good point that we actually do use ketamine in much higher doses, sometimes like 4 or 5 times higher doses, even in children. And when, at Enthea, we're talking to employers, that really helps break the stigma, because there still is so much stigma around these medicines. And when people hear like, oh, this is the same thing you give to children in higher doses, it does make them feel a lot more calmer and accepting of like, okay, if it's safe enough to give to children in doses that are 5 times higher, I should be okay doing it in a therapeutic setting in a lower dose. So yeah, just really important point to bring up.
Stellate ganglion block is kind of like that downregulation of the autonomic nervous system, upregulation of the parasympathetic nervous system, and just kind of a reset, like a reset of that. Like again, I think that analogy really works well as like that fight, flight, or freeze that people live in, and just being able to like have that cellular level release that you don't always know what happened, and sometimes it's better to not know what happened. Like I like EMDR for the most part. Eye movement desensitization and reprocessing. I'm trained in that. That being said, it can be really activating for people to like talk about their trauma, and not very helpful. So many people come to us after having gotten treatment for decades, and they've talked about their trauma for decades. And human language is such a blessing and curse, that huge reduction valve. So much of the human experience you just can't describe with words.
That was like a really difficult process for us of, figuring out this credentialing process, and then, continuing to update it and review the data that's out there. And I'm with you with the risks of at-home ketamine or at-home injectables in high doses, like at-home ketamine in high doses without protocols, or at-home injectables concern me quite a lot. But I'm also, to be fair, really worried about these ketamine clinics that don't provide any psychotherapy, just give you an IV of ketamine and be like, okay, well, go home after and we'll never talk about what happened or how this worked or if it had any effect on you, which is also quite common. You have a lot of clinics where you just have a nurse on site that's administering ketamine and there's no psychosocial support. And so, yeah, just things that are definitely important. Safety is, something that could break this industry. We have something that could really revolutionize the way we treat mental health. But if it's not in a safe container, it could go the other way. A couple of weeks ago on LinkedIn, I just did a post saying, hey, if you don't know where to start and you want to find a ketamine therapist, or you want to learn more, like I put my cell phone number and I said, just message me and I'll help. And I got like 72 texts in just
Oh
a
my
few.
gosh.
Yeah,
Wow.
yeah. And so like people are curious and they don't know where to start. So yeah.
The medications and stuff, yeah, it's like, oh, well, just take this medication, it'll make the symptoms go away. And it's like you just always have that voice in the back of your head that's like, okay, but like how do we fix this problem? Or at least that's how I felt. And so I went for years and years just being like trying to convince myself that it's okay that you're this person now, and it's okay that, but I never really could accept that answer. And I think kind of what Sherry was saying, like with all the research done, like a lot of the stuff, the pills, the blanketed responses to when people have been diagnosed with something, they don't always work. And so in a way, it's really wonderful that, ketamine is kind of this scary drug in a sense, but there's so many people that they have tried so many different things. You get to a point where you're just like, I surrender. Like, just give me anything, like anything new, anything. So that's what's kind of nice about it, I think, at least at this point, is, it is so different, but at the same time, there's so many people that they've kind of tried everything that just seems safe, that just seems normal, that just seems, like comfortable.
This has been a Shut Up production.
Shut up!